Good afternoon. Today I'm going to be talking a little bit about perioperative anxiety. And I don't see my clicker. Great. So perioperative anxiety is something we think is just, every patient has it. Why do they have it? You know, whatever, they're going to have it. But really it affects the healing time of a patient. It affects their need for narcotics. It affects how they experience having surgery as a process. So they experience anxiety for a variety of reasons. Among the most common are fear of the unknown, fear of pain, and fear of loss of control. So there are a lot of different ways to approach dealing with that anxiety. Some patients, we all know them, they need like every detail that you can give them. Most patients just need minimal facts. When we give them their teaching materials, though, we need to make sure that we're doing it as jargon-free as possible. Stress and fear affect their information absorption, and only 36% of adults really have basic health literacy. So what's normal jargon or normal talk for you and I really doesn't make a lot of sense for them. Prior to the day of surgery, helping patients with pre-op education is an effective strategy for decreasing anxiety. Some of the basic components of a peri-op education program include laying out the basics of the procedure, making sure the NPO and time of arrival instructions are clear. We all know those patients who didn't quite understand them get canceled, a huge increase in anxiety for when they have to come back, and it's just so disruptive for their lives. Many facilities hand out this information, but it is often generic. It can be very confusing. This is especially true if you're in a hospital, because in a hospital setting, they're really covering everybody from the inpatient to the outpatient. And so trying to tailor some information just for your patient really was helpful for them to be more compliant. Also, making them feel engaged, making sure if it has their name on it, they feel like you took the time or your staff took the time or the hospital took the time to make sure that they were involved, that they thought of them as part of the process. Giving a patient a simplified rundown of what will happen at the facility pre and post-op is a good way to decrease that fear of the unknown. Developing a post-operative pain plan will help with that fear of pain. We all know surgery is painful. We do our best to help them not have pain. So anything we can do to help develop a pain plan for them so that they know what to do will help them and also help them in their healing process. Ensuring that they have their prescriptions for their post-op care beforehand will allow them to have everything filled. It decreases their anxiety. I know personally, as the only driver in a family, that thinking, okay, I've got to get myself to the hospital, get my surgery, get home, figure out somebody to take my prescriptions and have it there so I'm not in pain waiting. That was a huge stressor for me the last time I had surgery. So having those things beforehand is a huge help. Discussing non-narcotic pain relief strategies is really helpful as well. We certainly don't want them taking so much narcotic that it actually impedes their healing. There are many new non-narcotic type of strategies that they can use. Give them an overview of what to expect the first 48 hours at home. What they should do, what they shouldn't do, who their contact information is. Having it beforehand will help them because right after surgery, they're not going to be remembering. Their family may be a little stressed. They won't remember as well. And this is a great kind of teaching experience area for your mid-level practitioners. It's also good to work with your facility. If you have a small office, work with your facility to have their pre-op nurses cover this information so that you get the information to the patients. And it's comprehensive, it's covered, you feel like they have a good grasp and that you don't have to spend that extra time. You're busy, but those other people in the system can help you. The day of surgery. Patients often report feeling abandoned in the preoperative waiting area, especially if the schedule gets thrown off. They feel they don't understand what's going on. Why are they waiting for so long? But the patient next to them, 2 people have gone in while they've been waiting. Allowing family members or a support person to stay with the patient will help decrease their anxiety throughout the preoperative period. It helps also for that person not to be anxious as well, and they'll help absorb more of the information that they need. Keeping the patients updated throughout the pre-op wait is a huge satisfier, and it really does decrease anxiety. If the room is delayed, making sure that someone lets that patient know, hey, this case before you took a little longer, we're going to be, you're going to be about half an hour later than you thought. You're still, we know that you're here. We're going to take excellent care of you. All of those words really help them. And frequently rounding by pre-op nurses gives patients that opportunity to ask questions and just to feel like someone cares. We all know pre-op areas, hospitals and facilities are trying to cut budgets. They're trying to streamline as much as possible. But you really need a focus by a pre-op nurse or pre-op charge nurse to make sure that they're touching base with each of the patients waiting so that they feel like they're engaged in a process, then they're not just a number in an assembly line, because that assembly line feeling will really ratchet up their anxiety. Encouraging use of materials that can distract patients. We all know facilities don't like people to bring a lot of expensive electronics, but music has been shown to decrease patient anxiety significantly before invasive procedures. So if you have a way for your facility to let them bring an iPod, or if they have their phone to listen to music, TVs and videos are also another great distractor to help them kind of keep themselves calm so they're not focusing on their anxiety and ratcheting up. It's really nice if your facility can provide those or provide headphones for them to listen. Not all facilities like, but as really you're the consumer for that facility, so you have some power to talk to them and to say, hey, my patients aren't happy. I really want you to start looking at doing some things that'll make them happy. I want them to bring iPods so that they can listen to music. You have that power. And using touch to connect patients to the patients beforehand is always great. Just letting them know that you care, that you're thinking of them. And not just for you, but also for the nursing staff, to take that extra few seconds to touch them on the arm, to look them in the eye, let them know that they are not just part of an assembly line. In the operating room. We all know operating rooms are really loud, crazy places. We're trying to move fast, staff is trying to count, you're trying to get the patient in, you've got 3 or 4 people coming and going. That adds a lot of stress. It adds a lot of anxiety for your patients. So really, trying to help them and help your staff around you. Remember not to be talking too loud. It's really helpful. Turn off the radio when the patient's coming in. Remind team members to watch their words. If you've got a staff member counting, saying a word like needle, hypo, scalpel, blade, patients hear that. It just really gets them more anxious. They're going to use that on me. Am I going to feel that? All that anxiety is right there. And talking about, you have 2 people sitting in the corner. Oh man, did you hear that patient in 25? They just had a code. That patient on the table's hearing that. So try to remind them, hey, this patient's going off to sleep or they're getting sedation. Please, I need you to, try to be a little quieter. Go out in the hall to talk. It really does help them. Patients remember things that are said when they're under sedation. I can't tell you, I've had a patient actually tell me they remembered things that were said when they were off to sleep. So they do remember, we've got to remember what we're saying. And using touch and holding hands, especially if they're getting propofol, something painful, it really help them calm down, help them focus on something other than the pain in their IV as they're starting off to sleep. Another thing though about intra-op words do matter. So when you're intra-op, saying words like surgery, really hurt. It's scary, right? But word procedure isn't. Talking about what they're doing, also just trying to take that language out of the jargon will help them be less anxious. So post-op support, really ensuring that the patient has clear and concise instructions, gets rid of that fear of the unknown. They'll know what to do when they go home. If they're feeling anxious about it, that really, they don't want to leave they don't want to leave PACU because someone's there to take care of them. Now they're going to be on their own with a family member. It's really scary. So letting them know exactly what they have to do, what not to do. Yes, the first 24 hours, it's going to be sore. Don't say hurt because that's even bigger, right? It's going to be sore, but we're going to give you these. You're going to have. Remember, you have your pain medicines at home. This is your action plan. You know what you're going to do for pain. They've already got those things at home. Now you can reinforce it with them and help them remember. Oh yeah, I know what to do. I've got all that taken care of. And then making sure that the patients have contact information for support. that they know who to call if it's late at night, when to call. Don't call because my incision is itching at 2 o'clock in the morning. That can wait. But if you're having bleeding or you're having severe pain that taking your medication is not helping, we want to hear from you. Not only just who to call, but also reaching out to them. Have your office or make sure your facility is doing postoperative calls to reassure them, answer any questions. You can catch a lot of issues early. Is the patient starting to develop an infection, but they're afraid to call the office? A lot of people don't want to bother you. You're a surgeon, you're busy. So just having someone reaching out to them is another huge way to decrease anxiety as they start to heal. Those are my references. If you have any other questions, we'll answer them at the end.